Are you confused about what the difference is between Medicare Supplement and Medicare Advantage? Well, I'm going to do a quick overview with you today. Okay, so let's start with the good. The best thing about Medicare Advantage is the price. That always gets people's attention, and it's hard to get them past the price. And to understand that there are some drawbacks as well, because they see what is, unfortunately, termed as a free plan, which is completely not free. Medicare Advantage does, in many cases, offer plans that have a zero monthly premium, but that is not free. You still have to pay your Medicare Part B. That's going to come out of your Social Security check every month. So it's not free. Plus, you've already paid into Medicare Part A the whole time you were working. So it might have no monthly fixed premium cost. And most counties across America will have a plan with zero premium available. If you're really healthy and you hardly ever use your insurance, and you hardly go to the doctor, you go once maybe a year, twice a year for a physical, and maybe you get to know, maybe you get the flu or something once a year. This is something you really want to consider, because with a Medicare Supplement plan, you're paying that fixed monthly premium each and every month, whether you use it or not. Now, the second big plus is the extra benefits. There's lots of extra benefits that you're going to get with Medicare Advantage plan that you will not find with original Medicare or in a Medicare Supplement. But these will vary dramatically from plan to plan, from company to company, from county to county, from zip code to zip code. So in general, there are lots of extra benefits you will not find in original Medicare. Original Medicare doesn't do anything for dental, nothing. It does very little for eyes. Now, a Medicare Advantage plan, especially this upcoming year, can have lots. You're seeing more and more plans that are providing you with meals when you leave the hospital after an inpatient surgery. That can be a tremendous benefit. If that's available, that also has transportation. So that when you go to the doctor, you go to the hospital or to the pharmacy, they will pay for the transportation there. So many extra benefits that it's actually kind of mind-blowing. Like I said, it does depend on the plan. So now let's switch around to the cons, the negatives of Medicare Advantage, okay? I already said price was one of the big things and price is also one of the worst things, because unlike Medicare Supplement, where you have a fixed price, I know I'm going to pay $158 a month, and that's each and every month all year, whether I use it or not. Boom. Medicare Supplement is stable. It's fixed. It's predictable, and some people love that predictability. So now let's switch to Medicare Advantage. There's no predictability, there's no stability. I have no idea what's going on because you pay when you use it. You have networks and doctors that can jump in and out of these plans at any time. There is a 20% exposure that Medicare Advantage plans do not cover for cancer treatments. So this month, I don't go at all. If I had a zero premium plan, I wouldn't pay anything at all this month. Now, I'm down into the weeds on the 6th month into my new year, and now I get bronchitis. So now I have to go to a doctor, and then it progresses into pneumonia, and then I had to be hospitalized. It got so bad. Now I'm in the inpatient stay. So with the Medicare Advantage, I would pay a copay to see the doctor. That might have been $20 each time. Then I had to go see a specialist because I kept getting worse, and that might have been $40. Then I had to spend 2 nights in the hospital because I got so bad, and that might be an extra $300 per night. So now I've quickly spent almost $700 when I haven't spent anything the rest of the year. Now, when you do the math, this still might be advantageous, even though you do pay copays every time you use it. When you add up all your copays, it still might be a net gain over having a fixed monthly cost. That's why it's great for you to have options. So you're going to tell us what you think, what your risk is going to be, and then we'll tell you, okay, maybe you should go down this road, or maybe you should go down that road. Medicare supplements, the pros are the fixed costs and the stability. You know what you're going to pay the same no matter what. If I go to the doctor 5 times a day, every day, I'm going to pay the same amount of money as if I don't go all year. Okay, so the cons of the Medicare Supplement Plan are they don't have all these extra benefits, but some of them do have a gym membership, and some do have plans that will help you quit smoking. You know, that's for us to do the research and to help you find out what those plans are. But they're not going to have a dental, vision, hearing aid plan. So that is just a real quick overview. So like I said at the beginning, I'm not trying to say one's better than the other because I think they're both great plans. And often I sell one to one person in the family and one of the other to the other person in the same family. So it's just, if you have different health concerns, different risk aversions, different doctors, and that's why it's nice to have options. Thanks for watching this video. If you liked it, please let me know in the comments, and please give me a thumbs up if you found it valuable. Down in the description below, I do have a more full in-depth description about those 2 options that you have. It's inside my Medicare workshop, and that is free for you. So go down in the description below. I have a link to it. I also have a link to some other goodies, like you can download our free Medicare and Social Security cheat sheet. So go ahead down below and give us a like and click on those links. Also subscribe to our channel. I'll keep putting out new videos all the time to keep you updated and help you along in your Medicare journey. So thank you, and I'll see you on the next video.